this again. What is the tilt table test? And how is this related to hypermobility? And what exactly can you expect from this test is the subject of this video. Hi, I'm Dr. Shakib from Hypermobility Therapy right here in Irvine, Orange County. And tilt table test is one of those things that I do recommend and I do ask my patients about. So let's figure this out and see what that's all about. We want to do tilt table test to identify if you have POTS or if you have what is referred to as vasovagal syncope, or you have what is referred to as orthostatic hypotension. So I'm going to explain all of that, and let's just begin. So you want to make sure that if you're taking any medication, you want to discuss that with the testing center because medications do make a difference, especially if you take hot medications. And you want to wear comfortable clothing. When you go there, obviously comfortable clothing because they're going to turn you, and you obviously want to be covered if that's what you care about. So you're going to be standing up, and what they're doing is they start basically moving you and tilting you and trying to measure essentially your heart rate and your blood pressure. That's what we're looking for. So essentially, the differences and the things that we're looking at, what we see is going to identify if you have POTS, if you have vasovagal syncope, or you have orthostatic hypotension. When it comes to orthostatic hypotension, basically blood pressure drops, and what you want to drops drastically when you're standing up, and that's what that is. When it comes to POTS or postural orthostatic tachycardia syndrome, there is an increase in heart rate, drastic increase in heart rate. And with syncope, it's a drop in heart rate and blood pressure. That's essentially it. So then once it's identified as if it's which one of these it is, then the recommendation changes. There are medications that are given for each one of these, which is not my area of expertise. But when it comes to orthostatic hypotension, which is again a blood pressure issue, this is a sign of blood volume. Typically, salt and fluid is recommended. If it is POTS, which is an increase in heart rate, there are medications that are provided for that. And generally speaking, electrolytes and fluid are good to take. And for vasovagal syncope, that's again a drop in heart rate and blood pressure. They do need to see a cardiologist for this and the management of that. When it comes to seeing patients with POTS, I do have to watch what we do, what kind of exercises we do, what's the status of what they're doing, basically their state that day. And there are a bunch of different precautionary things that I do with regards to the type of work I do with joint hypermobility. A lot of times we have to modify the exercises for those situations. Compression garments are very, very helpful, especially the ones that cover the pelvis and abdomen. They really help with blood circulation and with POTS. I have seen that in my practice. I strongly recommend that to my patients because it's all about creating less stressful environment for your body, and that's a very easy fix. I've done videos on compression garments. We're going to make sure that we include it with this video so you get to watch it. If you have not subscribed to the channel, this is your opportunity to do so. Make sure you turn on the notification bell so every time I do a video you get notified, and make sure you ask your questions in the comment section below, and I'll be more than happy to answer them. Until next time, take care.